Good afternoon, folks. So happy to have you joining us today in celebration of AANHPI Heritage Month. The Asian Pacific Islander American Health Forum is so pleased to welcome Dr. Meena Seshamani, Maryland's Secretary of Health, for this fireside conversation with our President and CEO, Juliet Choi. This conversation today will reflect the evolving healthcare landscape and all the challenges facing families and communities, from healthcare affordability and Medicaid uncertainty to rebuilding confidence in public health and preventative care. We're so excited for this discussion today, and I'm so pleased to turn it over to Juliet to kick us off.
Great. Thank you so much, Chelsea. Good morning, good afternoon. We're so excited that you're joining us for this fireside chat. I want to extend my incredible thanks to all of you joining us from across the country, your community leaders, your advocates. You personally inspire me. I know you wear so many different hats. And you are right there taking care of our communities, our families, and just giving us so much hope and inspiration. I'm absolutely delighted to welcome Dr. Meena Seshamani, especially as we celebrate Asian American Native Hawaiian Pacific Islander Heritage Month. It's 1 month, but we all know we are celebrating our communities all year round. Dr. Seshamani serves as the Secretary of Health for the wonderful state of Maryland. I'm so grateful for her partnership and leadership, especially during such an important moment for public health, healthcare access, and all of our communities. Right now, all of our communities are navigating real uncertainty. Across the country, people are concerned about rising healthcare costs, changes in coverage, Medicaid access, food access, and the growing challenge of knowing what health information we can all trust. These concerns are not abstract. They affect how people seek care, whether they will delay treatment, and how connected they feel to the systems meant to support them. At the Health Forum, we're so proud that you and so many of our partners across the country are part of our network of over 300 community partners with a reach into 41 states, as well as territories and Pacific jurisdictions. We know you're all bracing for the real damage, detrimental impact of Medicaid worker requirements. And at the same time, we want to be able to hold up our communities and families, celebrate joy, make sure we're getting preventative care, and uplifting one another. Of course, some of the concerns are discontinued disenrollment as it relates to the marketplace, questions around Medicaid, Medicare, Medicare Advantage. We know food banks are running out of food and navigating different policy concerns. And of course, the cost of inflation is really having a daily impact on how we are all attempting to survive and thrive. We know many of these impacts disproportionately hit our Asian American, Native Hawaiian, Pacific Islander communities. And that's why it's so important, thanks to Dr. Seshamani, that we wanted to have this virtual and, can I say, intimate conversation with you together. From a policy advocacy standpoint, you give us strength here in Washington, D.C., where we attempt to be our community voice here with elected officials. I do want to share one example. Just this month, the Health Forum did send a letter to the Senate detailing the harms of work requirements on AANHPI communities. Asian Americans, for example, represent almost a fifth of gig workers in the United States. We have so many, almost 3 million small business owners represented by AANHPI small business owners. And again, we're managing what is real information, what is disinformation, what is misinformation, not just in English, but in language, and cultural relevancy is so important for all of us. And I know many of you on the front lines, you're having really hard, challenging, but very critical conversations about the role of caregivers, whether you're taking care of an aging parent. If you are part of that sandwich generation where you're taking care of your parents and you're taking care of your loved ones, younger loved ones. Again, it gives me a lot of joy to invite Secretary Seshamani, who brings a very unique perspective, not just from the federal and state government perspectives. She's a practicing physician, and I'm just going to say this, she is from our community. In her role as Secretary of Health for Maryland, Dr. Seshamani stewards a $20 billion health system that encompasses public health, Medicaid, disability, behavioral health, also a really important issue for our communities. And her purview also includes touch points with 11 state-run hospitals. She leads the state's mission to improve the health and well-being of all Marylanders through a focus on accessibility, affordability, and equity. Prior to her cabinet appointment, Dr. Seshamani led at the federal level as the director for Center of Medicare, where she stood up the historic Medicare drug price negotiation program, introduced payments to support community health services, caregiving training, and navigating patient care. I could say so much more about her incredible public service and leadership legacy. She's a board certified head and neck surgeon and an Oxford trained health economist. Thank you again to everybody for being here, to all of our partners, and Secretary Seshamani, thank you again for joining us.
It's
Okay,
it's
go
really
ahead.
an honor to be here with all of you. And Juliet, may I just say that as you were describing the the things that we are navigating today, how much that resonated with me, both personally and professionally. I mean, one thing that you had not mentioned, I mean, you mentioned I am part of the community. I'm also a mom in the sandwich generation, right? And I think, I do my role here to kind of help everyone in the state to navigate the changes that are going on. I'm also helping my own family to do so. And I think that's something when you come back to what are the things that are really the strength of our AANHPI community, I think some of it is the fact that we have community, we have strong senses of family, and like that is something that I think we can all leverage to help us and support us as we're navigating the changes that are coming our way that you so well described.
Well, thank you again, Dr. Seshamani, and we've known each other for
A long
maybe
time.
a minute or two. So with our community partners here and there, I may end up just saying Meena. And so the good doctor. So we have. So what we'll do is just share a very open, community-driven fireside conversation. We do want to make sure we've got some time towards the end for any questions that we may receive. And so, Dr. Seshamani, you know this, especially in Maryland, and I know you have a pulse of communities across the country. So many families are really feeling uncertainty right now, especially around Medicaid coverage. Again, a lot of our partners who are joining us today are right there on the front lines. You were with us at the Voices Conference, I think a couple years ago, and so I think you've met a lot of our community leaders. But as it relates to Medicaid coverage, healthcare costs, and shifting public health guidance, from where you sit, what are the most urgent challenges you're seeing on the ground in Maryland? How are they affecting communities? And hearing from you, I know our community leaders are going to want to take some of your observations and carry it back home to their communities.
Yeah, I mean, I think a lot of what you talked about, the changes to Medicaid, the changes that have occurred with public health guidance, they have created, and even beyond that, to what has been happening around immigration policies, around overall disruptions, changes to the federal government. I mean, Maryland is #1 in the country in terms of states losing jobs because of the federal job cuts. I think all of that has created an overall sense of uncertainty and anxiety that really permeates to the core for people. And that then manifests in these various ways. And so some of what we're trying to do here in the state of Maryland is really be able to provide that steady hand, that clear head to help everybody to navigate this. And I think that's where I'm so excited to be able to talk with all of you, because any state leader, anyone in government cannot do it alone, right? I mean, these are things that, again, really get to the core of how people feel living in their communities. And that's why it's so important that we have this strong partnership with people in our communities. So I think, as you mentioned, the changes to Medicaid, I'll start there. The first thing that's going to come into effect October 1st is that asylees and refugees will no longer be eligible for Medicaid. We know that that is a huge issue for our AANHPI population of immigrants. We are preparing to have materials that we can, distribute, and really want to be able to work with our community partners, as I know other states are doing as well, because we're going to have to help families to navigate where they can get healthcare, and also to reinforce that those immigration changes do not affect pregnant women and children. At the same time, I think we all know that how for mixed status households, how do you get care for your children while other members in the family may no longer be eligible? And that's something where we are really looking forward to partnering with all of you on. The second area is what you mentioned, Juliet, around the work requirements. There are really two aspects to this. It's for the population of people where Medicaid was expanded because of Obamacare. So largely the childless adult population. Starting in January, they will have to redetermine their eligibility every 6 months instead of a year. And they will also have to demonstrate compliance with these work requirements. I think the big thing that concerns me with this is the potential administrative burden that creates for everyday people who are just trying to get by, how that compounds some of what you mentioned, Juliet, about language difficulties, other things, that we want to do everything we can to make this as easy as possible. So on the technology side, we're doing a lot in Maryland to try to automate things as much as possible so that people don't have to go and collect pieces of paper, bring them to an office. We have a one-stop shop, one application app that people can access on their phone to be able to determine eligibility for multiple programs, not just Medicaid. And we are leveraging that for these new requirements. We are going to be pulling in automatically diagnoses to determine if someone has a chronic disease that can exempt them from work requirements, pulling in National Student Data Clearinghouse data so that if someone is in school, that exempts them from work requirements, and also wage data so that we can automatically demonstrate where possible that someone is working. We're trying to do as much of that as we can in an automated fashion. So I think that's one aspect. The other comes back to working with all of you, because I think you all probably know, as soon as the One Big Beautiful bill passed, people thought that their coverage was already gone. And there is so much that we all have to do together to kind of explain, okay, here's what's coming. It's not here yet. Here's what you will have to do. And I think that's also where we want to make sure that we are partnering with all of you. So we're going to be putting out pretty soon. We are going to have outreach of changes are coming to Medicaid. Make sure that we have your updated contact information. We want to help you to navigate this process. Stay tuned for more information. And then our plan is to follow up in the fall with more detailed and targeted outreach to specific populations who are affected by this on what they have to do. And that it's going to be really important that we are all working together. I say that for the state of Maryland. It is the same for any state, that this really is complicated and causes a lot of anxiety, and people are going to have to work together. And I think the other area that you mentioned, Juliet, is vaccines and general public health. You may have seen, I think it was this morning, the news that the two leaders of the U.S. Preventive Services Task Force have been let go. There's a lot of changes occurring at the federal level, and we all are working hard together to let people know that like we can help provide information that people need when they go to their doctor to figure out how to stay healthy. And so in Maryland, we've issued standing prescription orders for vaccines to reduce barriers. We just passed the Vax Act, whereby the Secretary of Health can have a list of recommended vaccines that insurance companies have to cover at no cost. And so that's also where I think it's really helpful for us to work together, because when people are trying to sift through all of the confusion, they turn to their local community leaders, right? And so it's going to be really important that we are all working together on that as well. Like, I really think, Juliet, a lot of it comes back to, in a time of tremendous disruption and anxiety, where can people feel that they're getting the support they need? Where can people feel that there are people who have their backs, right? And I think working together, we can give that support for people in our communities.
Well, thank you so much for that, Meena. And I think I'll just comment here, appreciating the implementation of HR1, or the One Big Beautiful Bill, especially as it relates to Medicaid and worker requirements. To hear that the state of Maryland, for example, is leveraging technology and ensuring a one-stop shop for folks. My hope is, and this is what we've heard from our community partners, Juliet Health Forum, what are the promising practices that are emerging from the state level? So everything you've highlighted, I think, is really instructive, not unique to Maryland. And so if
Right.
other states are not implementing or thinking like this and engaging community leaders, I think these are definitely some promising practices that collectively we can try to cross-fertilize across the country. So again, you started talking about this. Let me ask you to peel back a little bit more. You talked about really the vital role that community organizations need to play, have always played, right? Being that interlocutor, being that trusted voice of translating important government-driven information, but at the same time, candidly, as a result of language. English is my first language, but sometimes some of these governmental policy guidances can still be very confusing. And we want the messaging to be culturally relevant. So how important is it for community organizations and governments to be working together to move forward together in these uncertain times? And I think a little bit more specifically, we have some incredible community leaders here. How can they further drive that community partner state government partnership?
So I am so glad that you asked that question. I will start with the end of what you asked, which is that it is so, regardless of what state you're
Yeah.
in, I think it is so important to tap into your state's, like, health departments, external engagement, for a few reasons. For some of the reasons that we talked about, Juliet, that there's going to be a lot to navigate, and being able to help with getting the word out and, supporting people as they're trying to navigate these changes. But I'll even back it up a step, where it's been really helpful for us to hear from people in the community of what is needed, right? Like, I can sit here at my desk and try to figure out on my own, like, what I think a community might need to be able to make the best policies and programs I can, but that's only going to get me so far. And so I think it's really important that it is that full engagement, that full cycle of, here are the things that should be thought about and considered, where you all are a resource for us for like brainstorming and figuring out like what could be a better way to do something. And then similarly, with implementation, being able to get the word out and work together there as well. I will say, coming back, Juliet, to where you had started on the trust and the uncertainty, I think certainly things weren't being done perfectly before, right? There clearly was this sense of hesitancy around public health issues. People didn't understand like kind of what it means. To your point, a sense of government speak, right? I mean, I'm in healthcare, and sometimes I feel I have trouble navigating these documents that I get from insurance companies and such. So there is a lot of room for improvement, and that's where I think getting that input is really helpful. And I know on the health forum side, as you were saying in your intro, like I think you guys are doing that with the federal government as well, because again, at the end of the day, we want to improve the health of our communities. We want to be able to engage in that way. And so making sure that everybody is hearing from all of you is going to be really important.
I really do appreciate that. And also what you underscored that what you are doing and leading in the state of Maryland. I mean, these are pragmatic efforts that are incredible community leadership across the country can really try to be that voice in their respective states.
And I
Um,
will also say, Juliet, it comes back to what you were saying about how diverse the AANHPI community is, right? Like that's also where I think, particularly for our community, it's so important that community organizations are involved because people in government may not think about the differences between, a Chinese Mandarin population and like a Punjabi population and a Filipino population, right? Like, and I think that's where, having the community leaders helping to honestly, it's leveraging that diversity as a strength in terms of how do we then make sure that we can reach different populations and support them in the way that they need to be supported, you know?
Yeah, no, absolutely. Leveraging that diversity as a strength. I want to say myself being in DC, that's not a phrase I hear as often these days. And certainly, just giving a shout out to our partners in Hawaii, our Native Hawaiian Pacific Islander leaders. I think there have been just some incredible, wonderful practices out of the state of Hawaii when it comes to community and state government partnerships. Um, you did mention you encouraged our partners to get involved. If you don't already have a relationship with your state public health leader, that sounds like a little homework assignment for us. Like reach out, make sure that connection happens. I think a lot of states have a commission on AA and HPI affairs. For myself, on my wish list is to see more AA and HPI leaders become part of their state Medicaid agency's advisory board or review board. So just dropping a couple of homework assignments for all of us collectively. So I'm going to shift gears a little bit here. I do have to say, personally and professionally, it's just a wonderful privilege, Meena. I mean, we've been hanging out. Gosh, it's I can't believe I'm gonna like over a decade now.
Hmm.
And so to have this conversation today just gives me a lot of joy. This is Heritage Month after all. I want to take a moment just to recognize your incredible influence, your public service, particularly, not only, but particularly, let's put the spotlight on you as a first generation Indian American leader. So, would you mind sharing how has your Indian American heritage influenced how you serve and lead?
Well, maybe I can start with where you picked up on something I said about leveraging diversity as a strength. I think growing up as a first generation, right? My parents moved from India for graduate education. And my sister and I were both born in the US with the sense that, we have opportunities that we would not have had perhaps in India. And the growing up, right? I was going to school, in New Jersey, going home, eating my idli and sambar and, going to temple and praying and learning Sanskrit prayers. And there was definitely, if you will, like a duality to that journey growing up. And I think that's something that I've really, as a kid, it's hard, right? I mean, I remember when I was in preschool, I still vividly remember this. When I was in preschool, my mom getting ready for work one morning, and she's fairer skinned than I am, and she was putting on her foundation. And I literally thought that she was doing that so that she could look more white.
Mhm.
And, so it wasn't always easy, right? Growing up, being one of the only, non-white kids and, how you navigate that. And I think over time, over years, coming to see that as actually a secret superpower. I mean, we all have navigated many different environments. We're navigating different expectations on us. We're navigating different assumptions about us. We're like, that's a strength because it means that when you are dealing with complex things like what we're talking about, how do we take something like these work requirements and find where there is an opportunity in the crisis to be able to improve things? I think that that diversity of experiences from growing up, where then maybe you don't take things for granted. You really have that sense that people come from many different paths, and it's really important for us to listen and embrace all of that. I think that's actually, at the end of the day, a huge strength for us, especially in healthcare, where people's experiences in their homes and their communities, as you all know, drive 80% of what makes them healthy or not. And I think that is a strength that all of us can really harness, and especially in the AANHPI community, where even among us, there's so much diversity, that we all have this inherent understanding of that, that then enables us to connect with others, I think, in an effective way.
Well, thank you. Yeah, I really appreciate your candor there. Uh, and I feel like we're all extended families. So as a follow-up question, can I just ask, so what is your favorite comfort food?
My my favorite comfort food is something called rasam sadam. So this is like for Tamilians, my family's from Chennai. It's like our version of chicken noodle soup. So it's like this tomato lentil soup and you have it with rice. And that is absolutely like when I'm not feeling well, like that is my go-to.
Love it, love it. Thank you. Okay, everyone's taking a note here. Okay. From your vantage point again, what do you see as particularly important for AA and HPI communities to take notice of and take action on, right? I mean, we're talking about the impacts of HR1, we're talking about Medicaid. Is there something you also mentioned vaccinations earlier on? Is there something else that we should really take notice of and really, create some movement and take action?
Yes. So can I give more homework? Does that mean I can give more homework?
Well, you can give me the homework and then we'll invite everybody else to join us.
Um, I am concerned about where things are headed with behavioral health in our country. So, as someone from, an Asian background, I think as it is, there is more stigmatization of behavioral health in our communities, right? I think it's been well studied that AA and HPI communities are less likely to report when they are having behavioral health needs. I'm sure many people have experience from their own families in this regard. I will say this is one of the things that I have been so thankful to our Lieutenant Governor, who's the first Indian American Lieutenant Governor in the country. And she speaks openly about the behavioral health struggles that her family had growing up and how that has really driven her to take on behavioral health in her work as Lieutenant Governor. We are now in an environment where I am concerned that there is a moving backwards in terms of the stigmatization, where we want to continue our programs in harm reduction and making sure people have what they need who are engaged in substance use. And there are guidances coming from the federal government about what is allowed and what isn't. There's also, recently been the executive order on deprescribing for behavioral health needs. And I think for our communities, being able to really take up that torch of behavioral health is health. Period. Stop. Full stop. And so being able to work together to make sure that people and their families continue to feel that they have people who they can turn to if they do have questions about behavioral health, if they need support. I think that's going to be especially important for our community because we have a history of maybe having a little bit more reticence about engaging in this area.
Yeah, no, thank you so much for underscoring that. I don't think we can underscore this enough. I think it is also how do we invite those kitchen table conversations and be able to say, whether it's in English or in our own language, that mental health or behavioral health and wellness is a matter of your health and well-being. I just do want to add, I think a lot of our leaders may know this, um, but for Asian American, Native Hawaiian, Pacific Islander young people from the ages of 10 to 24, we have some recent research published by HHS SAMHSA, so the agency, Substance Abuse Mental Health Services Administration, that suicide is actually one of the leading causes of death for our AANHPI youth from the ages of 10 to 24. So I'm so grateful, Meena, for you putting the spotlight on that. The Lieutenant Governor, I think there is a lot of cultural stigma affiliated with just talking about, like, I'm not feeling well, and I think maybe I need some help. So thank you to you for putting a spotlight on this. And I just want to invite all of us. You just never know when you ask someone, how are they doing? That just may be the opening to allow for a trusted conversation. And it really can be a matter of life or death. So thank you for putting the spotlight on this issue.
And I think, Juliet, if I can pick up on something you said about the language, I think we also know about how different languages have different words for things, right? There are like words that don't necessarily translate one to one from one language to another. And at least I have found as I have navigated, Tamil and English, that happens particularly in like the relationship space and the emotion space, right? Like, I mean, I'll give one example. Like, chamate in Tamil means obedient, I think technically. That's very much like a positive, like this is a really good thing, right? But like I think we can also see from like that Western culture, well, like is obedience always like a good thing, right? Like I just give that as an example. I'm sure in all of our languages, we have examples like that where being able to connect with people in their language can be particularly important, especially around issues of behavioral health.
Yes, yes, absolutely. Uh, and just to echo that, I fortuitously just last week was in a community meeting with other Latino and African American leaders, and we were having a brief conversation about this topic. And it doesn't necessarily mean jumping into a conversation and saying like, "Hey, how's your mental health well-being?"
Right.
Right? It could be you have that community meal, maybe a cup of coffee, a cup of tea. Are you sleeping well? Are you eating well? What's keeping you up at night? And just trying to find, I think, especially given the challenges out there, there's just a sense, a yearning for belonging and connection, and that really can be the door to open some of these really, really critical conversations. Well, thank you for
And I
that.
think, well, I think that also comes back to Juliet when you asked me what my comfort food was,
Oh,
right? Because you also said at the beginning about food, right? Like I think there's been another area of a lot of swirl has been around food, what is healthy food, what is nutritious. And I think like food, I mean, especially for a lot of our cultures, is very much a part of our community and, how we come together and like being able to have that cultural awareness as we are working to help people live their healthiest lives, I think it all kind of comes together like that.
Yeah, absolutely. Absolutely. Okay, so I know in the advocacy space, especially in this journey and championing of public health and keeping our communities healthy and well, there's some real challenges. But let me shift gears a little bit, Madam Secretary. Uh, what gives you confidence? What gives you confidence and hope? I think for folks to hear from you as the State Secretary of Health in the wonderful state of Maryland, really getting your perspective is something for us to want to listen to and see if we can amplify. Meena, tell us what gives you confidence and what gives you hope.
I mean, honestly, it's things like this. It's the fact that you are bringing people together to talk about how we can support our communities. I mean, sometimes the we find our strength in times of challenge and in times of crisis, right? Where a crisis becomes an opportunity. And so someone said to me the term apocalyptimism, and I am totally embracing that. But, right, I mean, like, we are in a time where we can't take things for granted. And we have to come together and realize there is strength in working together, perhaps even more so than in times past. And I think that can lead us on a path to ultimately be stronger and be able to really set ourselves up for continued improvements. We knew that things in healthcare could be better, and we have to find those paths. And really, it's up to us. And I think what's great is that we're realizing that we can't do it alone. So it's important that, I will say we at the state, as an example, we obviously get a lot of money from the federal government for our public health initiatives. Clearly, over the past year, not yet year and a half, the partnership between state and federal government has changed. And so this is where we have to say, well, where are the opportunities then? We need to think about partnerships differently, where we are now looking at the business community. We're looking at breaking down that silo between public health and traditional healthcare delivery. And we're using money in our payment model, healthcare payment model in Maryland, to pay for healthy food. So I think there are those kinds of opportunities. What is the saying? Necessity is the mother of invention. But I think there are those opportunities for us to work together in different ways that will enable us to come out stronger as we are navigating what is a very difficult time.
Well, thank you for that. And I do want to acknowledge, let's see, I'm going to jump over, take a quick look at some of our Q&A that's coming in. You did talk about behavioral health and mental health and wellness. The one follow-up question we have here is, what's your suggestion to try to change the dialogue on this so we can talk more about prevention when it relates to behavioral health care for the AANHPI community? I think that's a great question, and it's not easy to navigate.
No, it's definitely not easy to navigate. I will start overall. So I think one of the things that we have done is really creating more of a focus on children, youth, and families, right? I think traditionally there's been a lot of efforts around serious mental illness in the adult population. And I think we all know that much of that oftentimes stems from what happens in childhood. So about a year ago, not yet a year ago, Maryland Department of Health released a roadmap for how we are going to improve care, focusing on children, youth, and families. And it includes things like bringing home and behavioral health services into the home and the community for kids with serious mental illness. We've also released guidance and have a center of excellence for screen addiction and what is, healthy engagement with social media. So we're doing things like that. I think specifically for the AANHPI community, I'm also going to pick up on something, Juliet, that we talked about, which is the role that family plays in our communities, right? Many times you have multi-generational families, and there are differences in terms of how people view behavioral health. And I think that's where it's going to be really important, again, that we are partnering together with community leaders, because it may be that there is a teenager who can't talk to his or her parents about something but wants to have that avenue, or where there can be someone else who's then bringing the family together to be able to discuss things as more of that neutral third party, and being able to help support those conversations in a culturally appropriate and sensitive way, I think is also going to be really important.
Thank you for that. And I may mispronounce the person's name. Thank you, Owen Bui, for sharing that question. Really, really timely and important. Another one, oh, hi, Roy Cosme. So a recent study by Johns Hopkins indicates that the American public wants healthcare systems to be accountable for solving for health inequities. The Ryan White Act, let me see. The Ryan White Act on the federal level provided a proven model. This was going back into the 90s
Mhm.
for requiring community participants to be included in statewide and local councils to determine how to allocate funds for treatment and support services, right? So we're really talking about community engagement again. From your perspective, how can community partners participate in a similar way to help healthcare systems eliminate health inequities in today's era?
That is such a great question. Um, I can speak first to Maryland. So, Maryland has a unique payment model. I mentioned this a little bit. So, we have a payment model that creates what's called global budgets for our hospitals. So, hospitals have a budget within which they provide care. So, if you keep people healthy, you keep them out of the hospital, that actually is aligned with working within a budget in a way that if you get paid for each head that gets admitted to a bed, it's not quite as aligned. And that has enabled opportunities for partnerships with the community that otherwise, may or may not have been there. And I think that's where we have care transformation initiatives and efforts like that to really help bring the communities together. While that is a unique payment model for Maryland, other states in the country absolutely are down that path as well. There are various models that CMS has put forward to really encourage, as you are talking about, that accountability. And where there is an accountable care organization, and you can find the list of accountable care organizations on the CMS website to see, is there a group of providers that have taken on the task of providing more holistic care for a population and being able to partner with them. There's also, Juliet, as you mentioned in the beginning, Maryland writ large has payments for community health work, for care navigation, training, caregivers. That's another huge opportunity for partnership of community organizations with local providers, because there is a potential cash flow for them to provide these kind of services. And so there is an opportunity to then be able to provide those services. That's exactly why we put those into place when I was leading the Medicare program. So I think those care models, like the accountable care organizations, and in Medicare, those kind of the wraparound services that we wanted to make sure that advanced primary care can provide, are two main areas where I know that clinicians are eager to be able to get some support to better take care of their communities.
Yeah, that is really, really wonderful. I do think for our community partners on the line, we work together with you on additional educational opportunities, but also policy advocacy efforts.
Mhm.
I do think for our communities, all communities, getting a little bit smarter about accountable care organizations, what that really means, how that plays out. And then when you mention different payment models, where you can leverage Medicaid and Medicare, particularly for community health workers.
Exactly.
I think that is a very tangible but important touch point or nexus for all of us on the community side to get a little bit smarter about, see which states have done a more inclusive, progressive approach. I say progressive, small p, on finding payment models that can amplify and really value the contributions of community health workers. So thank you for that. Okay, the questions are coming in, and we have a few more minutes, so we're good on time. I think I know this next person too. So Dr. Sherry Boyle hails from the great state of Pennsylvania. So we all know that this is like the classical mantra. There's a shortage of multilingual, culturally responsive providers, particularly in the behavioral health care, mental health space, and especially for AANHPI communities. Are there any strategies we can consider to strengthen really how to impact changing the diversity of the workforce going forward? And we all know, Meena, right? This is not an overnight exercise. I think it's just one of those classical, very, very tough systemic challenges. So share us your words of wisdom on this one.
Well, I do keep a magic wand in my office
Yeah, thank you.
for magic wand. I wish I had a crystal ball, right? But Juliet, actually, that question comes back to some of what we've been talking about in this way. I think where we can reach out to kids, people in middle school, people in high school, and kind of show them what is available in terms of various health professions, and particularly behavioral health for our communities. Because again, if behavioral health is not something that people have been open to kind of talking about, then it may not even be on someone's radar. And some of the things we're doing in Maryland, like we are investing in our area health education centers, our AHECs. We're in fact going to be opening a new one in Southern Maryland. And some of the programs they have are to have programs with middle schoolers and high schoolers to just open their eyes, to expose them to different healthcare professions to see if there's something that they might be interested in doing. And so I think it really starts from there. And then working with people who are in college, if there are people like my medical assistant ended up going back to nursing school, where there are people already in healthcare, and how do you help them to progress in the pipeline? I think those are all opportunities we have. And the last thing that I'll say is, especially in behavioral health, but really in all fields, people with lived experience can be so much more impactful in their jobs. And this is where, when you have people who are engaging in healthcare, is there a career opportunity for them as a result? So we've invested, for example, in peer recovery coach training for people with substance use disorder. So they're going into rehabilitation. This is an avenue of job training and certification for them, which then enables them to leverage their lived experience to be able to help others, and also gives them a path to economic stability, which we know helps them to then not relapse. So, I think particularly for our communities, it's seeing where there are those opportunities. Like I said, we have them in Maryland. I am sure they exist across states. And the other thing I'll say is that CMS released a lot of money for rural health transformation to states, and workforce was one of the areas that nationally CMS recognized as a focus. We in Maryland have that as one of our 3 areas of focus. So I think looking at states' rural health transformation grants is another good way to figure out where there may be opportunities to plug in on workforce.
Great, great, great.
See, we're giving lots of homework.
Lots of homework. You're actually giving me a lot of homework as well, Mia, which is great, great. And I'm glad you mentioned rural health. And just to baseline this for our community network, from the health forum stance, On one hand, we know that CMS at one point in time had issued $100 million for community navigators and reduced that down to 10 million. On the other hand, the opportunity, Meena, as you've highlighted, CMS issued tremendous investments in rural health. And we also know for AANHPI communities, we're showing up in places we did not show up 10 years ago, right? We are outside
Absolutely.
of the urban hubs, right? So I do think for those who are joining today's conversation and carrying this conversation going forward in our own discussions, I think we also need to think about what does rural health mean? What does that look like for AA and HPI communities? So thank you so much for that. So I feel like we've talked about workforce, behavioral health, information, being a trusted voice, navigator, cultural relevancy. One of my favorite topics, disaggregated data. So before we close out, on one hand, there's a lot of concerns that certain federal data sets are being erased. That certain data sets, the federal government is no longer investing in that same effort or continuing those efforts that had already been established. So going forward, when it comes to disaggregated data, can you speak to how is the state of Maryland leveraging disaggregated data? And as community leaders, by definition, we are advocates and ambassadors. What can we do to ensure that disaggregated data remains top of mind? Because we know if we're not counted, we will not be seen and we will not be treated.
That is exactly right. And so I will say this is another example where changes from the federal side have led to, I think, states stepping up. For Maryland, we recently launched our health indicators dashboard. So I'm actually really glad that you asked this, where we now disaggregate data on things like cancer screenings and chronic disease prevalence by different demographics. So, for example, in Maryland, AANHPI communities have a lower rate of breast cancer screenings than the rest of the population, lower rates of cervical cancer, colorectal cancer screenings, higher rate of diabetes than other populations. And I think that's really important for all of us to know to what you said, Juliet, because if you are not visible, then you're not able to be taken care of. But also when we think about like, how do we best leverage resources in the smartest way possible, right? I think everybody agrees that we want to be as effective as we can with our work. Being as effective as you can means knowing where your efforts can really make a big difference. And it really is in those areas where you see that there may be a group of people who are being left behind that we need to then focus efforts. And that doesn't have to be, because of race or because of ethnicity or because of language. It's like just as an operator, where do you put your resources to have the most impact? And I think that, to your second point, can be a way to be able to advocate with anyone. I know that in the national discourse, DEI has become this three-letter word, but really ultimately, if everybody wants people to be healthier, how do we most effectively target our resources and spend our money in the smartest way to achieve better care and the best health outcomes that we can? And that's why disaggregating data from an operator perspective can be really valuable.
Yeah, thank you so much. My new mantra on disaggregated data and just ensuring, A NHPI communities are counted, but really candidly, and especially in the backdrop with the anti-DEI discourse right now. I mean, all communities must be counted and served. So my new mantra is count us and count us in.
I think that, and that applies to everyone,
Everyone,
every community.
every
And
community. Yeah.
And the other thing, Juliet, that we didn't talk about is how is that data being collected, right? Like, so one of the other things that we're doing in Maryland is we have training for people on how to collect the data by these different
Mm.
ways so that you can have better reliability of the data that you're collecting. So I think that's another piece. As each of you are talking with your states and with those who are collecting data, really working to make sure that there is a more standardized way that it's being collected, because what is that famous saying, garbage in, garbage out, right? So like I think that is the other side to that disaggregation of data coin that we also have to keep in mind.
Thank you so much. Well, we are winding down. Let me see. I think we've got a couple minutes. Meena, we just got one more question.
Okay.
So my attempt here is to try to be as responsive to our terrific community leaders who've joined us. Uh, so, Dr. Seshamani, you have experience at the federal level, as we know, not just at CMS, but also at the White House. I know you were at the White House. So how has this influenced your approach to state leadership now? Is it the same? Is it different? Is it more challenging? Is it more exhilarating?
Well, I love both. They're different. I mean, I think at what I love at the state level is just how tangible and on the ground it is. I mean, I mentioned that I grew up in New Jersey, but I've lived in Maryland longer than I've lived anywhere else in my life. In fact, this weekend, my son is representing Maryland at an East Coast volleyball tournament, and I have Maryland pom poms so that I can thoroughly embarrass him. Um, but I think it's so wonderful to be able to serve my community. I've traveled to, I want to say, 20 of 24 counties in Maryland at this point. Within a year of being in this role, I traveled to every region in Maryland. Like it is a microcosm of America. We have the, Appalachian Mountains, we have the beach, we have urban areas, farmland, everything in between. And there's just something so tangible about that, where you can really forge connections on the ground. You can see, I mean, health involves everything from housing to food to labor, right? All the things that we've been talking about today. I work very directly with our Secretary of Agriculture, our Secretary of Housing, our Secretary of Labor. There is that connectivity that you really have on the ground. The federal side has tremendous impact, right? I mean, when I ran Medicare, Mark McClellan, if you know him, he introduced me at former CMS administrator, introduced me at a conference and said, with one payment rule, she moves more money than the GDP of several countries. And like there is that scope that you have with, a federal job where, especially with Medicare, right? People look to where Medicare is going to see where they should go. And so, if there's one thing that I have realized by now having done both, is that neither can do it alone. Having that partnership is what can really drive the needle, where you can have that kind of scope and impact and perspective at a national level, coupled with that knowledge on the ground of how things are working, and then partner with all of you, with the local communities. That's the secret sauce that's going to actually enable things to get done. And that's where we are really putting our shoulder to the wheel. Even in times like this, there are continued opportunities for all of us to partner together.
Thank you for that. That is a wonderful way to wrap up this fireside chat conversation. I want to thank all of our community partners again. This has been recorded, and so we'll be adding this to our Health Forum YouTube channel. Meena, Dr. Seshamani, Madam Secretary, thank you so much for this very informative but also very helpful, heartfelt conversation. And so, if it's okay with you, I'll probably be circling back to see, like, maybe we can do a follow-up conversation, in the months and years ahead.
That would be
And count,
wonderful.
yeah, count on the Health Forum. We're here cheering you on. We want to be a resource to you. And thank you again. And everybody, wonderful, happy Heritage Month, good health and wellness. Take care.
Thank you all. Bye.
Bye.